The clock's ticking tonight as President Joe Biden launches a new vaccine goal for our country. In 2 months, the president wants to see 70% of Americans with at least one dose and 160 million fully vaccinated. So tonight we're looking into Indiana's drop-off in daily doses and this plan to get the Pfizer vaccine to kids 12 to 15 once the FDA approves it. But we want to start with what doctors say it's going to take to reach this new goal set out by the president tonight. In fact, we're going to leave that QR code on your screen right now to access the latest vaccine info as Emily Longnecker kicks things off.
We're going to keep you for 15 minutes today.
It's not a matter of asking, should I get the COVID-19 vaccine, says Dr. Romuletti.
I think the question is, do I want to get COVID or do I want to get a vaccine?
The second area of focus,
with a push by President Biden for 70% of the American population to get at least one shot by July 4th, the chief physician executive with Community Health Network says he'd be in favor of a vaccine mandate to get there.
Businesses may start saying we want to see a vaccine before you get on. That's probably what's going to trigger that 70%.
Not only does a vaccine protect you from dying from or getting a severe case of COVID, Dr. Uletti says current data shows it also cuts down on your risk of transmitting it.
What we don't know is that is there going to be a different variation or variant that's going to come in the next month or two, which you may be able to spread.
That's why when it comes to wearing a mask, Dr. Uletti says you first need to consider if you're outdoors or indoors.
Being outside without a mask, vaccinated or not vaccinated, is definitely much safer than indoors.
Right now, the CDC says if you're fully vaccinated, you don't need to wear a mask at outdoor gatherings or when dining outside with friends from different households. Folks who aren't vaccinated should still wear a mask in such cases. Where it gets tricky is if you're indoors, where some people are vaccinated and some aren't.
And so if there's some vaccinated and some not vaccinated, then it's probably better to err on the side of caution and wear a mask indoors.
Guidance that could change should a variant of the virus show up, that even the vaccine won't prevent you from spreading.
We don't know what the next few months is going to hold. So that's what we're trying to be careful, is we don't know if any one of these upcoming variants is going to cause a problem or not.
With this new vaccination goal for the United States, I want to show you where Indiana stands right now. 36% of Hoosiers who are 16 and older are now considered fully vaccinated. That's just about 2 million Hoosiers. Now that percentage does go up to 46%. That's when we take a look at the number of people who've had at least one dose of any of the vaccines. But the CDC says that Indiana is still in the bottom 10 states when it comes to our vaccine rates. Let me go ahead and explain the reason why. The number of doses that are given each day are these green bars that you see here. Now, the number of doses given each day peaked about a month ago, back in early April, and then it dropped off. In fact, we've actually started seeing it level off a little bit over the last week. Now, in order to increase vaccination numbers, some clinics are opening up to walk-in appointments, and that would include Marion County's East Side Clinic off 33rd Street. That one's open Tuesday through Sunday, offering both Moderna and J&J shots.
With the FDA now set to greenlight Pfizer's vaccine for 12 to 15-year-olds within the week, there is a new plan to improve access for families. The government plans to ship the vaccine to 20,000 pharmacies all across the country and will send it straight to pediatricians' offices, so all you have to do is go visit your doctor. Today, we spoke with a local mom and pediatric doctor for Riley Children's Health, who says that she is trusting the science and she's ready for her kids to have a shot at getting back to normal life.
Certainly sounds like the data from the 12 to 15-year-old trial has been pretty reassuring in terms of side effects observed and the immune responses generated. What this really represents is a community insurance policy that our kids get back to the lives in which they can thrive the most.
In late March, Pfizer's study revealed its vaccine was 100% effective for people 12 to 15. Out of the 2,200 participants in that trial, there were no positive cases among those fully vaccinated. There were 18 cases among participants who got the placebo.
Now, to increase vaccination, the president also is ordering federal pharmacy partners to offer walk-in appointments and launched a new website making it easier to snag a time slot. Remember, you can text the word vaccine to this number that you see on your screen. We'll send you info on how you can get your shot. And that wraps up tonight's big story.